if they are too close to each other, a lot of information is lost because it is not gathered. If they are far from each other, multi-scattered information will, or multi-scattered light will measure the feedback information. How the array should be manufactured to get good or better information from the deep tissues. So therefore, even using a single fiber laser detector generated a lot of questions, and of course it came out that if you'd like to use this laser probe for skin, you use a different array than if you use this laser probe for brain or inner air or laser mucosa or stomach or lip or oral cavity. But the disadvantage was that it gave us always a single spot information, and this single spot information was buried. So if you move a little bit, lateral, you get almost different information, and it was also very difficult to reproduce the measurement, because if a patient came back to the clinic a week later, putting the probe the same place was almost impossible. So therefore, a lot of companies started to overcome this problem with the so-called scanning system, where the image is built up step by step, and bigger areas are scanned. Of course, what was lost is this solution, the temporal distribution, or the temporal sensitivity, because it needed time to go step by step through this way, and if you came back, time was lost. So therefore, everything has some costs. So this is another step forward when the full field lasers were applied for medical purposes. In this case, the focused laser light is shaped by optics, and in this case, not a spot is illuminated, but a larger area, and from this larger area we can collect information, and we use a 2D area photodetectors, which are very often cameras. Now the CMOS cameras are good enough to pick up this information and to see what's going on in a certain skin area. This is a picture what kind of information can be drawn from this kind of pictures. We can make perfusion map. You see the red is the weather perfused area. We can make a concentration map where the red blood cell concentration is indicated in perfused capillaries where the flow is slow. There is a high concentration of red blood cells. And this is the speed map, which is almost the opposite. Slow blood flow, speed, low speed, high concentration in the capillaries, and in the tips of the fingers, there is a high speed of blood movement. So, what are the major applications of laser photogrammetry? Post-operative monitoring of free tissue transport, especially when skin flaps are removed and replaced. It is very convenient to follow up the revascularization and the tissue regeneration. burns, it is also very important to make judgment when the skin is dead, when it's the necrotic process, and when to start to make some interventions to prevent the biggest problems. So, allergy, patch testing, skin disease research, gastroenterology, in disorders or measure the effect of treatment interventions. I have already mentioned some examples how to assess the cerebral blood flow in experimental circumstances, but nowadays and even now there are ongoing studies on human subjects to study the cerebral blood flow with lasers when the skull is open. It can happen in neurosurgery patients or patients with head injuries where the skull is removed and there is a way to access the brain tissue. So even now there are some ongoing studies where neurovascular coupling is followed in the injured brain or in the brain of various vascular diseases. So pharmacological trials to assess the effects of topical or systemic vasoactive drugs on tissue blood flow. It is interesting that in the dentistry, the lasers are also used. We can check the vitality of the parts, and many laboratory animal studies are done ocular, cerebral, cutaneous, hearing systems, plastic, renal blood. Again, what are the limitations of the laser blood flow? Does not give an absolute measure of blood perfusion, and these are limiting factors in chemical setting, and not in many healthcare systems are used. So in the remaining time, I'd like to talk a little bit more about multimodal imaging, which is involving the laser systems, and I'd like to also show you some other applications when we use the laser lines as indicated of the microcirculation network. And I'd like to switch back to the neurovascular coupling. This is a small blood vessel in the brain where the endothelial layer is followed by pericytes, endothelial neurons and microglia, and they do form the so-called neurovascular unit. In another cartoon, you can see that in the healthy brain, surface blood vessel is perpendicularly penetrating into the brain tissue. There are astrocytes, glia cells, and as I told you, in the sick brain, either the neurons can be swollen or diseased, and this neurovascular unit is disturbed, and the normal hyperincreasement, which is accompanying normally the local depolarization, is somehow disturbed, and this disruption can have prognostic values for the patient as well. So with the help of international collaboration and with the help of many enthusiastic people, we developed a multimodal imaging system in the laboratory when we investigate simultaneously many optical properties of the normal brain and the injured brain. And this optical system involves laser diodes with different wavelength. As I told you, the different wavelength do have different penetration depth and also different absorption properties, because in the brain, the absorbing and reflecting components are the surface of the brain, red blood cells, different types of tissues, and of course optical properties of the reflecting light carrying information on the tissue. So therefore, there is a multiple imaging system where the different light sources are somehow linked to each other. There is a normal time scale of the different light sources, and we can select which picture belongs to which light source. So again, this is the absorption spectrum of the normal oxygenized hemoglobin. You see that hemoglobin absorbs light from 500 nanometer till about 620 nanometers. And the deoxygenized hemoglobin, this hemoglobin lost its oxygen because it was diffused, because it was utilized in the tissue and different properties. So it absorbs also the light, but in a different spectral density. So therefore, if the spectrum is crossing in this range, we cannot distinguish between the oxygenated and deoxygenated hemoglobin. So therefore, this reflection is referring to total hemoglobin. And this reflection, because at 620, 640 nanometer, only the deoxygenated hemoglobin is reflecting. So this reflection is responsible for the amount of deoxygenated hemoglobin. So therefore, this information is about the local blood volume and also the local metabolic processes. This is one question that we offer blood. The other question, if this offer is used. And this wavelength is used for other imaging where there is almost no absorption, there is almost complete reflection of the light. So also with the help of international collaborators, Esther and her mentor were able to develop a nice method to convert the electrical signal to light signal using voltage sensitive dye. In this case, this dye is bound to the nerve cells and the glia cells, and if the intracellular electrical potential is changing, changes its optical properties, so therefore the voltage changes in the brain can be visualized. So in this case, we don't use single electrodes, we use a dye which is reflecting on the changes in the local field potential. This is a movie about it, and you see that there is a depolarization wave traveling through the brain surface. This means that these changes were electrical changes which were visualized by means of the voltage sensitive dye. So this was a video for spreading depression. This spreading depolarization also could be called spreading depression because the EEG activity is suppressed, as I showed you in the unfiltered signals, some pictures before. So another thing was already mentioned, which is the laser speckle image. And for demonstrating this, just please that my hand is moving. Yeah, this is carrying the information of the laser source. But what if it is fixed? If it is fixed, there is a speckle, which is the interference signal because of the rough reflecting surface. And this backscatter light and the interference picture could be stable forever if my hand was not moving and the surface was not changing. But what if the surface is changing? The interference picture is changing as well. And if the change is fast, the interference picture is changing quickly. If the picture is not changing fast, the reflecting surface is not changing quickly. How can you see, how can you demonstrate changes in the reflecting surface? This is the change in contrast. You understand what does it mean? You see this picture because there's a big contrast between the white and black. If it is moving, the contrast will not be so big. So therefore we use the contrast analysis. And this contrast analysis is replacing this matrix 5 times 25 points with a single number, and we go through the picture and we make the contrast analysis picture. This contrast analysis picture is reflecting again where the contrast is big, there is no movement. There is no low contrast, there is a fast movement. And you see that in this picture, which is obtained from this low picture, we can make a flow map without any measurement of actual blood. You understand what I am talking about? Here in the capillaries, there is a low flow, high contrast black. In this venules, there's a slow but continuous flow. Slow contrast. In the arterioles, where the speed is very high as compared to the parenchymal venules, there is a very low contrast. So therefore, the velocity can be calculated. So this is a nice indication. And of course, we can take areas of interest for further analysis and to see almost the individual red blood cell. Again, this is not a red blood cell picture. This is a derived picture from the contrast, which it means that this is an image which is based on the speckle distance. And during the last couple of years, my colleagues worked on multimodal imaging of the cortical spreading depression, spreading depolarization, and changes in the local cerebral blood flow. So you see this is an optical signal, this is a flow signal, and it is for analysis purposes for various physiological and pathophysiological conditions. We can take all kinds of points of interest and we can make temporal pictures of this type of information. So what is the biggest advantage? We had the pleasure using the single point analysis. Now we have a means when we can look at the entire field of interest, and we can take single points or small areas of interest, and the temporal characteristics would be displayed in this simulation. So this is a picture which was done by Gabor Kozak, and he was attempting to see how is the different types of depolarizations in young, middle-aged, and aged animals. And I don't go into details, but you see the difference is obvious. In young rats, the depolarization happened, and the green color is indicating the long depolarizations. The white is the fast ones, not very few long depolarization waves. In the middle-aged brain, it is higher. These spots are representing the parenchyma. These black structures are indicating the big blood vessels, and we don't expect any depolarization from the big blood vessels because they are not as behaving like neurons, neuronal tissues. And you see that in the aged brain, this depolarization lasts a lot longer, and this long depolarization is characteristic for the entire brain. And if you consider how this depolarization effect is represented by blood flow changes, in an ischemic brain, in the young brain, at the beginning of ischemia, there are areas which are hardly perfused, but some of the areas are well perfused. In the middle-aged, the picture is almost the same. And in the aged brain, we see also some very well perfused areas at the beginning of ischemia. But as the ischemia goes further and further, in the young brain, there is a compensation. Even the badly perfused areas are somewhat compensated, and in the middle age, the same compensation happens. But look at the huge difference. In the aged brain, the situation is worse. So therefore, again, I'd like to show you that the laser line and the reflection of the laser line from the healthy and the injured brain is giving us information on the speed distribution, the perfusion situation, and we can see such differences which was invisible with the other techniques before we started to work with these methods. And finishing with just acknowledgements, I have the pleasure of various supports, industrial support, grant supports, but it was not valuable and enough without the help of my co-workers and many other people who worked with me during the last decades. But this lecture was based on the works done by Ferenc Bari, Eszter Farkas, by Igor Obradovics, Anna Justítovics, Zsófia Vera, Gábor Kozák, and Derek Clark, who spent some valuable time with us in the laboratory. So I'm just thankful for your kind attention, and I am ready to answer your questions. There are no stupid questions, just honest questions. So I try to answer everything. Thank you for your kind attention.
Have you thought about looking at scar assessment using laser Doppler flow monitoring?
Sorry?
Have you thought about looking at scar assessment using the flow monitoring? Yes.
Yes, this is an opportunity, but